Now to the Surgeon General calling for a tobacco-style warning label on social media, saying it poses a mental health crisis among young people. Elizabeth Schulze has those details for us. Good morning, Elizabeth.
Good morning, Rebecca. And the U.S. Surgeon General now wants to put those warning-style labels on social media, like what you'd see for cigarettes or tobacco. In an op-ed in the New York Times, Dr. Vivek Murthy writes, a Surgeon General's warning label, which requires congressional action, would regularly remind parents and adolescents that social media has not been proved safe. He says that similar labels that were put on tobacco products help dramatically reduce their usage. Now, Murthy is pointing to data that shows teens who spend more than 3 hours a day on social media face double the risk of anxiety or depression. The average user that age was on social media for almost 5 hours a day. Last year, Murthy sounded the alarm about how social media is contributing to a mental health crisis among younger Americans. He has urged Congress to pass legislation that would stop platforms from collecting data about kids and putting restrictions on push notifications or auto-scrolling. And while there is bipartisan support for some of those measures, none of them have passed in Congress. Guys.
Right, something Elizabeth. So many parents are thinking about here. 5 hours a day on social media.
Yeah. Trust me, I saw that number and I said I need to get home and take some phones away.
Right?
Yeah, exactly.
Oh, wow. All right. Thank you so much for that, Elizabeth. We're going to turn